Okay, good morning, everyone. My name is Tasha Penny, and I am a program manager at the Registered Nurses Association of Ontario. And this morning, I am going to talk to you about the ACPF program and provide you an intro into this fellowship and the different streams that are involved. But before I get into it, I just want to point out if you have any information, please contact Erica D'Souza. She is the project coordinator for the ACPF program. Okay, so today's information session is going to help you to gain an understanding of the ACPF program, identify the eligible requirements for participation, help you recognize the 3 key elements of the fellowship, and then I'm going to do a brief overview of our 4 types of fellowships to give you an idea of what they include and maybe give you an idea of what you'd be interested in applying for. And also I'm going to go over the application, the review process, and selection process. And finally, I'll leave you where you can go for some extra support and resources. Okay, so what is ACPF? ACPF stands for Advanced Clinical Practice Fellowship, and it's RNAO's fellowship program. And it does 3 main things. First, it provides registered nurses and nurse practitioners in Ontario the ability to, design a learning plan that meets their learning needs, specifically within their clinical practice. It's also a nurse mentoring opportunity. And as we know from the literature, the mentorship in nursing is so important, but not always done very well. So ACPF allows for that. And then for the organization, it's an opportunity to improve patient care based on the fellows' learning outcomes. Okay, so what are the eligibility requirements? So you have to be a registered nurse or nurse practitioner in Ontario, or working in Ontario, have at least 1 year minimum nursing experience, and you're either employed full-time or part-time, and you're able to dedicate 450 hours to the ACPF learning experience. You do have to have a mentor or a mentoring team in the area of focus, and I'll get to that later on. And you definitely need employer support from your organization. So your organization will be expected to provide some financial and material support, as well as there should be a culture of learning in which you're supported to actually do this fellowship. Okay, so in terms of the 3 key elements of the fellowship, the first one is the applicant. So this is you, and in ACPF, the applicant is referred to as the fellow. So the applicant is the individual who develops and submits the proposal to RNAO. You're responsible for making sure that the learning objectives you outlined in your learning plan are met. That you've included your organization in the entire process, and that you've accessed your mentors, even from the beginning of your fellowship all the way through to the end. And that's indicated in your proposal, actually, where, you'll touch base with your mentors and how they'll evaluate you. And then finally, the applicant's responsible for submitting a final report and executive summary to RNAO by the end of the fellowship. Now, the second key element of ACPF is the mentor. And the mentors are critical because they provide feedback and suggestions about your learning plan and your learning goal. If needed, they will educate you about their area of practice. And they should be able to provide, supervised opportunities to gain, special knowledge and skills that you're trying to attain. So this could look like job shadowing your mentor, or them setting up shadowing or site visits of other individuals who will give you that knowledge. Your mentor is expected to monitor your progress and meet with you regularly throughout the fellowship experience, and they participate quite heavily in the evaluation piece of your learning plan. And finally, you can access them to help assist in completing the final report. So let me go a little bit more into, who your primary mentor should be, and if needed, your mentorship team. So the primary mentor has to be a nurse with a master's degree. Now that master's degree does not need to be in nursing. They should have expertise in the fellowship topic. One of the things that we do ask for in ACPF is your mentor's CV, so that we can see, is this the best individual that's supporting you with your learning goal? Obviously, this is someone that should want to be a mentor and has the time to provide that to you. And they'll be, and they're agreeable to help you with your proposal, meet with you regularly, provide feedback, and then of course participate in evaluating your learning. Now, we get asked a lot, by applicants if they're allowed to have more than one mentor, and the easy answer is yes, of course. Sometimes people find that their primary mentor isn't able to give them everything they need in terms of meeting their learning goal. So you can develop a mentorship team. So your primary mentor still has to be that individual nurse with a master's degree, but the others on your mentorship team can have a range of educational or professional backgrounds. They can also be external to your organization, and they can be people with either clinical expertise or research expertise, or maybe, both. Okay, so the final, key element to the ACPF program is your organization. And in terms of, ACPF language, your organization is referred to as the sponsor organization. So they help you match your learning goal to some sort of need within the organization, which is best. The applicant's learning need should always drive the proposal, but of course it should match some sort of need within the organization. And this is something you address in the proposal. Now, the organization has to agree to provide you with release time from your regular duties, so that 450 hours. And as I was mentioning early, they have to provide financial support, and what we require is their agreement to provide a minimum of $5,000 to the fellowship. Now, your organization will ensure that you have the necessary human and material resources and support to finish your fellowship, and this is really the accountability of senior management. And they should demonstrate support for you, the activities, and of course the long-term sustainability plan in terms of the skills and knowledge that you'll gain. Okay, so let me move on now into the different types of fellowships that RNAO has to offer. And there are 4. So that's clinical leadership, the Best Practice Guideline Implementation Fellowship, and then our new fellowship, which is the AMS RNAO Fellowship. And I'll go over each of these briefly. Okay, so the first type of fellowship is the clinical fellowship. And this fellowship focuses on the fellow providing, direct development of clinical skills, knowledge, and expertise. So this is, your face-to-face client care. Now, throughout this presentation, I've provided examples of different types of fellowships from past proposals that have been submitted to us and have been accepted, just to give you some examples. So 2 examples I have here of clinical fellowships in the past. One was chronic pain management in the substance-dependent patient population, and then the other pressure ulcer prevention in the adult acute care setting. So as you can see here, these types of fellowships focus on what knowledge and skills you can gain to enhance the patient care you're providing. The second type of fellowship is the leadership stream, and it actually has an additional 4 areas of foci that you can choose from. So leadership focuses on the development of skills and expertise that support nursing practice and the profession of nursing as a whole. Now, let me go into these 4 different leadership foci. So first one being the education stream within the leadership stream, and it's focused on nursing education or client education. And a good example that I've pulled out here from a past proposal is learning strategies to best implement a pediatric palliative care education program for oncology nurses on an inpatient unit. Now, the management stream is focused on, providing leadership in patient care programs, management of human resources, and then implementing and maintaining clinical programs and program development. So an example here is a fellow had developing skills in development of strategic plans, program development, and program evaluation. And this was an early intervention program that this fellow was focusing on. The research stream is focused on all areas of research, anything to do with research that the fellow is trying to enhance. So an example, enhancing the skills to develop a research proposal. And then finally, the last stream within leadership is policy, and this is for individuals who are interested in learning more about policy formulation, advocacy, and change management. So one proposal that we did receive was advocacy and change management in the area of supporting increased breastfeeding environments. Okay, so this brings me to our third type of fellowship stream, and that's the BPG Implementation Fellowship. And other than the clinical stream, I would say this one is one of our most popular. And individuals interested in this type of fellowship are wanting to implement guidelines in nursing practice within their area of work, or help with the uptake of recommendations, or maybe the sustainability of BPG implementation. So a good example of this type of fellowship is supporting best practice for patient care. So a multiple branch implementation of the RNAO Assessment Management of Pain Best Practice Guideline. So with these types of fellowships, a specific RNAO guideline is trying to be implemented or sustained, as I said. Now, our fourth and newest fellowship stream is the AMS RNAO Fellowship. So AMS stands for Associated Medical Services, and they're a Canadian charitable organization that provides funding for clinicians to enhance knowledge and skills within their practice. So the major focus, though, from AMS and how it differs from the other fellowship streams is sustaining, enabling, or supporting humane, compassion, person-centered care in nursing practice. So it's the humane, compassion, person-centered care that's the most important part of the AMS fellowship. Now, within the AMS RNAO stream, you're going to be asked to pick out one of 3 core themes to focus on, and I will share that in just a second, but I wanted to provide an example of this type of fellowship, it being providing compassionate, client-centered care to patients with dementia in a long-term care facility. So this applicant was interested in implementing some sort of practice change where this patient population would feel like they were receiving compassionate, client-centered care. Now, in terms of the core themes, I won't read them out, but again, in the application, you'll be asked to pick one of these core themes to focus, your learning goal on, and that's self-identity, education, and work environment. So just briefly, self-identity is any activities that sustain compassionate care through your own practice. The education theme is those activities that enable compassionate care within, the unit or program or service area. And then work environments are those activities that support compassionate care. So, the healthy work environment and championing educational, clinical, and interprofessional behaviors that promote compassionate, person-centered care. Okay, so in terms of the application and review and selection process, if you're interested in applying for a fellowship, you have to submit a detailed proposal. So this proposal includes information about yourself, the fellow, your mentor or mentoring team, and the organization. You're going to have to clearly identify the need for the project, and then you're going to fill out a very detailed budget outlining how the funding that will be allocated in terms of what your organization is providing and what RNAO will provide. And then, of course, you're going to have to fill out a learning plan that outlines your goal, the objectives to meet your learning goal, and the strategies of how you will do that, the major outcomes that will come out of your fellowship, and then, of course, the evaluation piece of your learning plan. So requests for proposals, so RFPs, are issued twice a year at RNAO. Typically, there's one issued in November with a due date of mid-January. So the due date meaning the due date for the proposal. And then another RFP is typically issued in March with a due date in mid-May. Once we receive proposals after the RFP has gone out, we send our proposals to an external review team. So typically these individuals, they're volunteers and they're either previous fellowship participants or they're employees at one of our best practice spotlight organizations. So we have a really detailed scoring tool that we ask reviewers to use. We do inter-rater reliability testing to make sure that there is group consensus on what the score of the proposal is. And typically we will have meetings with our external review team to make sure that they understand the scoring tool, and then if there is any sort of conflict, they'll meet and hash it out and come to a final decision. Now, the applicant will be notified regardless of whether their proposal has been accepted or declined. And I do want to say at this time that even if your proposal has been accepted, you will probably have to complete a few additional revisions before starting the fellowship, and that's normal. And if it has been declined, we will provide detailed feedback with the hopes that you will reapply at another cycle. And we do encourage that you contact Erica D'Souza if you've been declined to get further information on how your proposal could have been strengthened. And then so overall selections made by RNAO for acceptance are based on that proposal score, as well as the funding available and if the revisions required have been met by the fellow. Now, in terms of extra support, I want to highlight a few resources that we have that are very helpful. So the first and foremost is our RFP. So when we post the application on our website, we post the RFP that goes along with it. And I would really suggest that before you even start filling out the application, that you review that RFP. And then when you are filling out the application, you keep cross-checking with the RFP to make sure that you have all the elements, because everything is spelled out there for you to make sure you have a successful proposal. We have workshops. A lot of our workshops now are being archived and will be uploaded to our website, so that if people aren't able to attend the live sessions, they'll be able to access it on their own times. So I would suggest watching every webinar, the first one being this one, the information session. We have an additional webinar on how to focus your learning goal, and then of course one on the learning plan. We have two information sheets that if you're new to ACPF and you're not quite sure how to approach a potential mentor or your managers to talk about this program, we have sheets that will help you to provide that information to mentors and managers. And if you're not sure what stream you want to pick out of the 4 that I've provided information on, we have a What's My Stream questionnaire that will help you to focus more. But I will just say at this time that the AMS RNAO stream isn't part of that questionnaire, but it is quite unique in terms of its focus. And then, of course, if you want to see samples of successful past proposals, then just contact Erica and she will be able to share that with you. Okay. So this brings me to the end of this webinar. Again, if you're interested in applying, I would really recommend that you either attend or go on our website and review all of our workshops. We also have question and answer sessions that we do live, and we do have past fellows present a little bit on what their fellowship was like, and then we can answer any questions that you may have depending on where you're at in terms of the proposal process. And we do encourage that you share this information with your mentors and senior management at your sponsor organization, and they're more than welcome to attend these sessions as well. So please check the events calendar on the RNAO website for any upcoming workshops. Thank you.